fitness standards for recruits and cadets. 103 point. General instructions for recruiting medical officer and dental officer. A. Examination protocol. Examination protocol. 1. The responsibility of completing recruitment medical examination rests with the recruiting medical officer. It is therefore vital that the recruiting medical officer is well versed with the basic dental anatomy, normal occlusion, and departures from it. Basic dental anatomy, normal occlusion, and departures from it. 2. All fit candidates will be disposed by the recruiting medical officer. All unfit cases on appeal will be referred to the nearest dental center. Dental officer will carry out the requisite examination as per guidelines laid down in these instructions. 3. Care will be taken to reduce service liability by limiting the entry of candidate with conditions that are progressive, recurrent, potentially malignant, or those that will be sought to be corrected for other than functional reasons. 4. Examination will be done in a well lit room as per the sequence elucidated in the succeeding paras. As per the sequence elucidated in the succeeding paras, the following instruments are advised to be used for intraoral examination. A. Intraoral mouth mirror with handle. B. Dental explorer. C. A good quality hand torch. And B. Award of dental points. Award of dental points. A total of minimum 14 points will be required for fitness, provided the following teeth are present in the upper jaw in good functional opposition to the corresponding teeth in the lower jaw. 1. Any 4 of the 6 anterior. 2. Any 6 of the 10 posterior. C. General explanatory notes. 1. Anterior teeth, incisors and canines. 2. Posterior teeth, premolars and molars. 3. Each incisor, canine, first and second premolar will have a value of 1 point, provided their corresponding opposite teeth are present. Important point. Each incisor, canine, first and second premolar will have a value of 1 point, provided their corresponding opposite teeth are present. 4. Each first and second molar and well developed third molar will have the value of 2 points, provided in good opposition to the corresponding teeth in the opposing jaw. 5. In case third molar is not well developed, it will have a value of 1 point only. 6. When all the 16 teeth are present in the upper jaw, and in good functional opposition to the corresponding teeth in the lower jaw. The total value will be 20 or 22 point according to whether the third molar are well developed or not. 6. When all the 16 teeth are present in the upper jaw and in good functional opposition to corresponding teeth in the lower jaw, the total value will be 20 or 22 point according to whether the third molar are well developed or not. 7. All removable dental prostheses will be removed during intraoral examination and will not be awarded any dental points. In the case of ex-servicemen applying for re-enrollment, dental points will be awarded for re-enrollment. In the case of ex-servicemen applying for the re-enrollment, dental points will be awarded for re-enrollment. D. Candidates reporting post-maxillofacial surgery or maxillofacial trauma. Candidates who undergo cosmetic or post-traumatic maxillofacial surgery or trauma will be unfit for at least 24 weeks from the date of surgery or injury, whichever is later. After this period, if there is no residual deformity or functional deficit, they will be assessed as per criteria laid down. E. Sequence of examination for reference by recruiting medical officers. F. Extraoral examination. 1. Gross facial examination. Presence of any gross asymmetry or soft or hard tissue defects or scars, or if any incipient pathological condition of the jaws is suspected, will also be a cause of rejection. Presence of any gross asymmetry or soft or hard tissue defects or scars, or if any incipient pathological condition of the jaws is suspected, will also be a cause of rejection. 2. Functional examination. Temporomandibular joint. TMJs will be bilaterally palpated for tenderness and or clicking. Candidates with symptomatic clicking and or tenderness of dislocation of the TMJ on wide opening will be rejected. Candidates with symptomatic clicking and or tenderness of dislocation of TMJ on wide opening will be rejected. AB. Mouth opening. A mouth opening of less than 30 mm measured at the incisor edges will be rejected. A mouth opening of less than 30 mm measured at incisor edges will be rejected. G. Intraoral examination. G. Intraoral examination. 1. Teeth. Number of teeth present is to be counted for award of points as mentioned above. Points will not be awarded in the case of the following: A. Dental caries. teeth with caries that have not been restored, or teeth associated with abscess and or sinuses will not be counted for award of dental points. Teeth with caries that have not been restored or teeth associated with abscess and or sinuses will not be counted for award of dental points. AB. Teeth having restorations that appear to be improper or broken or discolored will not be awarded dental points. AB. Restorations. Teeth having restorations that appear to be improper, broken or discolored will not be awarded dental points. AC. Loose teeth. Loose or mobile teeth will not be awarded dental points. AD. Retained deciduous teeth. Retained deciduous teeth will not be awarded dental points. AE. Morphological defects. The morphological defects, teeth with structural defects which compromise efficient mastication will not be awarded dental points. Teeth with structural defects which compromise efficient mastication will not be awarded dental points. Now 2. Periodontium. AA. The condition of the gums and teeth included for counting dental points should be healthy, that is pink in color, firm in consistency and firmly resting against the necks of the teeth. Visible calculus should not be present. Visible calculus should not be present. AB. Individual teeth with swollen, red or infected gums or those with visible calculus will not be awarded dental points. Individual teeth with swollen, red or infected gums or those with visible calculus will not be awarded dental points. AC. Candidates with generalized calculus, extensive swollen and red gums or extensive swollen and red gums with or without exudates will be rejected. 3. Malocclusion. Candidates with malocclusion affecting masticatory efficiency and phonetics will be rejected. Teeth in open bite will not be awarded dental points as they are not considered to be in functional opposition. Candidates having an open bite, reverse overjet or any visible malocclusion will be rejected. 4. Hard and soft tissues. Soft tissues of cheek, lips, palate, tongue and sublingual region and maxilla or mandibular bony apparatus must be examined for any swelling, discoloration, ulcers, scars, white patches, submucous fibrosis, etc. Any hard or soft tissue lesion will be a cause of rejection. 5. Orthodontic appliances. Candidates wearing fixed or removable orthodontic appliances will be declared unfit. H. When an implant supported crown replaces a single missing tooth, no dental points will be awarded. No dental points will be awarded. J. Fixed partial dentures or implant supported fixed partial dentures. Points will not be awarded for teeth, that is abutments and pontics, that are a part of an FPD or implant supported FPD. In such a case, if the candidate does not have enough dental points, he or she will be declared unfit. K. Sequence of examination for reference by dental officers. Sequence of examination for reference by dental officers. Dental officer will assess all cases referred by the recruiting medical officer as per the guidelines elucidated in the succeeding paras. Sequence of examination for reference by dental officers. Dental officer will assess all cases referred by the recruiting medical officer as per the guidelines elucidated in the succeeding paras. 1. Cases will be assessed using clinical examination and diagnostic aids as deemed necessary for providing a thorough professional opinion on the case. Dental officers must familiarize themselves thoroughly with the existing recruiting standards and exercise due caution before declaring a candidate unfit to avoid rejections being overturned during RMB as far as possible. 2. If any additional condition that renders the candidate dentally unfit other than that for which the candidate has been declared unfit by the medical officer is observed during the course of examination by the dental officer, it will be endorsed in the medical examination form. If any additional condition that renders the candidate dentally unfit other than that for which the candidate has been declared unfit by the medical officer is observed during the course of examination by the dental officer, it will be endorsed in the medical examination form. I. Extraoral examination. 1. Gross facial examination. Candidates must be seated upright in a chair. Any gross asymmetry, soft or hard tissue defects, scars must be noted. If present, relevant history must be elicited. Congenital malformations must be clearly identified and any progressive comorbidity is to be noted. Candidates with incipient pathological conditions of the jaw which are known to be progressive or recurrent will be rejected. Significant jaw discrepancies between the upper and lower jaws which may hamper means slow down or hinder efficient mastication and or speech will be a cause for rejection. 2. Functional examination. Candidates will be asked to open the mouth fully. TMJs will be bilaterally palpated for tenderness and or clicking. Candidates with symptomatic clicking and tenderness will be rejected. A mouth opening of less than 30 mm measured at the incisal edges will be reason for rejection. Dislocation of the TMJ on wide opening will be a cause for rejection. M. Intraoral examination. 1. Teeth. A. Dental caries. Carious teeth with broken down crowns, pulp exposure, residual root stems, teeth with contiguous abscesses, sinuses will not be counted for award of dental points. AB. Restorations. Dental officer will judge the soundness of restorations and award points accordingly. Teeth restored by use of inappropriate materials, temporary or fractured restorations, and restorations with doubtful marginal integrity or periapical pathology will not be counted for award of dental points. AC. Loose teeth. Teeth with clinically demonstrable mobility will not be counted for award of dental points. Teeth with clinically demonstrable mobility will not be counted for award of dental points. AD. Retained deciduous teeth. Retained deciduous teeth will not be awarded dental points. 2. Periodontium. AA. The periodontal health of the teeth included for counting dental points should be satisfactory. Clinical parameters such as color, that is usually pink, contour and consistency usually firm, texture, etc. should be examined. Visible calculus should not be present. AB. Individual teeth with visible calculus and or localized periodontitis will not be awarded dental points. AC. Candidates with severe periodontal disease will be rejected. If periodontal disease is not severe and the teeth are otherwise sound, the candidates may be accepted if, in the opinion of dental officer, he or she can be cured by simple periodontal therapy excluding extraction. N. Malocclusion. Any malocclusion of teeth like excessive overjet, reverse overjet will be assessed with respect to masticatory efficiency, phonetics and performance of duties. If malocclusion of teeth is in the opinion of the dental officer not hampering efficient mastication, phonetics, maintenance of oral hygiene or general nutrition or performance of duties efficiently, then candidates will be declared fit. Otherwise, reasons for rejection for malocclusion will be specified. Otherwise, reasons for rejection for malocclusion will be specified. The following criteria will be considered in assessing malocclusion. 1. Edge to edge bite. Edge to edge bite will be considered as functional opposition. 2. Anterior open bite. Anterior open bite is to be taken as Lack of functional opposition of involved teeth. 3. Crossbite. Teeth in crossbite may still be in functional occlusion and may be awarded points if so. Teeth in crossbite may still be in functional occlusion and may be awarded points if so. 4. Traumatic bite. Anterior teeth involved in a deep impinging bite which is causing traumatic indentations of the palate will not be counted for award of points. O. Hard and soft tissues. Soft tissues of the cheeks, lips, palate, tongue and sublingual region must be examined for any swelling, discoloration, white patches, submucous fibrosis, ulcers, scars, etc. All potentially malignant lesions. All potentially malignant lesions will be a cause for rejection. Clinical diagnosis for submucous fibrosis with or without restriction of mouth opening will be a cause of rejection. Bony lesions will be assessed for their pathological or physiological nature and commented upon accordingly. Bony lesions will be assessed for their pathological or physiological nature and commented upon accordingly. P. Orthodontic appliances. Fixed orthodontic lingual retainers will not be considered as periodontal splints and teeth included in these retainers will be awarded points for dental fitness. Candidates wearing active fixed or removable orthodontic appliances will be declared unfit. Fixed orthodontics lingual retainers will not be considered as periodontal splints and the teeth included in these retainers will be awarded points for dental fitness. Q. Implants. When an implant supported crown replaces a single missing tooth, the prosthesis will be awarded dental points as for natural teeth, provided the prosthesis is in functional opposition and the integrity of the implant is confirmed. Or fixed partial dentures or implant supported FPDs. FPDs will be assessed clinically and radiographically for